Heart disease is the number one cause of death in the developed world. It is the leader of the four most common causes of death: cardiovascular disease like heart attacks and stroke, cancer, neurodegenerative diseases like dementia and Parkinson's disease, and metabolic diseases like diabetes. 19 million people die from it every year, being the leading cause of death for men, women, people in the US and abroad. It is caused by a combination of genetic factors and environmental factors. The basic histological cause of it is plaque formation inside the arterial wall, what we call atherosclerosis. Hi, I'm Dr. Navarre and welcome to my channel, Vibrant Health and Longevity. Let's talk about how atherosclerosis begins. Let's use a simple analogy. Imagine your blood vessel as a street lined with houses. The houses are your arterial wall. The fence in front is the endothelium, a single layer of cells that controls what moves in and out of the arterial wall, regulates vessel diameter, and coordinates clot hemostasis. Lipoproteins containing LDL, ApoB, and HDL, ApoA, are constantly passing by the fence. Some LDL particles enter the subendothelium space. HDL particles typically enter and exit this space without issues, not causing any problems. But LDL particles, once in the subendothelial space, can become oxidized when exposed to reactive oxygen species. When this happens, they tend to not only remain in this space, but also attract other LDL particles. This oxidation triggers an immune response, marking the beginning of the atherosclerotic process. Let's delve some more in the immune response. When oxidized LDL accumulates beneath the endothelium, the body triggers its biochemical 911 response. Immune cells called monocytes arrive on site and transform into macrophages. Like the hawk, these macrophages engulf oxidized LDL, trying to remove the problem. When they take in too much, they become foam cells, which clump together to form fiber streaks, the earliest visible signs of atherosclerosis. Over time, smooth muscle cells migrate to the site, creating a fibrous cap around the lipid core. This structure evolves into a full-blown atherosclerotic plaque. This process develops slowly, often over decades, and can remain silent until it causes narrowing of the artery, what we call stenosis. When the stenosis is severe enough, it can cause the typical chest pain or pressure, which occurs when the demand for oxygen by the heart muscle is not met. Narrowing of the arteries is what can be seen in a cardiac catheterization. Let's discuss next plaque calcification and rupture. Progressing along as plaques mature, they may become calcified, which is the body's way of stabilizing them. It is arguably a good thing, but unfortunately indicates advancing disease. This can be measured by a coronary artery calcium scan. To be clear, a score other than 0 indicates some degree of calcified plaque in the arteries, hence presence of atherosclerosis. If this is the case, steps must be taken to mitigate or slow down this process. It is important to understand that having a calcium score on 0 does not always mean that you have no atherosclerosis. You still could have soft plaque. The only way to detect those is with a CT coronary angiogram, and I would suggest adding the clearly analysis to it. Now, non-calcified plaques are unstable and far more dangerous than calcified plaques because they can rupture. If that occurs, a clot forms acutely blocking blood flow, leading to a full-blown heart attack or stroke. And unfortunately, up to 50% of individuals don't survive their first heart attack. To put things into perspective, the vast majority of us over time will develop some degree of atherosclerotic cardiovascular disease, but not all of us will die from it. It is important to know where you stand and to address and mitigate all possible risk factors. This will be the topic of another video. My name is Dr. Navarre and you are watching my channel Vibrant Health and Longevity. Until next time, stay radiant, stay strong, and keep on thriving.